Okay, this was yesterday, the 12th of June. Trish still in the apartment, uh, still claiming to be evicted. And it was like a 12-hour stream because at some point, after a big old nod off, Trish dropped the phone, but had the other phone going. Kind of like right here. Okay. So Trish totally spaced out that there was another phone on YouTube streaming. Now there was no visual. It was a black screen because it fell on its front. And so we got to hear everything. Trish was pausing the other live, but not pausing the phone that was forgotten. Elk has not uploaded it. I am praying that she got it because it was so long. I fell asleep with my headphones on. It's a wonder I didn't have nightmares. This couple was in the background fighting from morning all the way through till the next morning. Trish came on looking really bad. Makeup, tried to do a sunset so it was blue and red and gold, and it was just outlandish. I swore Trish was going to try and go for a 5150. Poor Hubs was playing Diablo, and I'm sitting here with the tablet up to my ear trying to decipher Trisha's mumblings to someone and then the couple in the back. Because the couple in the back, during their arguments, was talking about substances in specific terms. Well, then, guess who showed up? Mr. Fisticuffs from earlier that Trish supposedly fought, whatever that chicken square dance was. If that's how Trish fights, then anyone could kick Trisha's butt. But I don't know why you would. I wouldn't get near those sores. But he's back. So then the couple and Mr. Fisticuffs are out in the living room. Mind you, Walnut Boobs is in the bed the whole time. She's in Trisha's bed as usual. She's been camped out there smoking her foils for a couple weeks now. So she wakes up because she's usually in a stupor. And she wanders out there because you can hear her shuffling. And then the four of them are talking and Trish is mumbling into the TikTok. Still not aware, completely unaware that YouTube is on. And no mods in the YouTube. None whatsoever. There was like 21 people in there that I saw. And, oh boy, they all started talking about how Trish owes them money. Trish owes them. And Trish went out and tried to verbally squabble and defend herself, but she couldn't. She owes everyone money. And you wonder about that check. So then Trish comes back, and at one point, everybody in the chat is like, Trish, you need to go to rehab. And Trish gave the usual play on semantics. I am sober. I haven't drank alcohol. And I've been clean for 43 days. No, you haven't. I relapsed once after my birthday. Wrong. We saw you nodding off yesterday. We could hear you nodding this morning. Okay? A few times because the live was that long. So somebody, and I don't know if it was someone from here or if it was someone just from somewhere else, somebody said those are Tranq sores. And Trish argued. And I didn't get it. And Hubs even said, you can use my phone if you want because I was getting so damned upset. Trish, you're going to have to trust me on this until I can find a clip. Someone had to have got it. Trish said, Tranq sores emerge in a circular pattern. and are black. Wrong. And I think I've proved that, but we may have to take a venture into some ugly pictures. First, I want to show you something that Penn State does, because Pennsylvania is kind of ground zero with Kensington. Penn State has one of the biggest addiction studies programs in the nation. I mean, they have a lab on their streets, so why not take advantage of it? It puts help out on the streets, and you have constant case studies shuffling around your town. So this is from the Journal of Addiction Medicine. Wait, I have a better one first. Hold on. This is the one I'm looking for. Okay. It's called CAMP. Okay. The Center for Addiction Medicine and Policy. And it's out of Penn State's Medicine. Penn Medicine. Okay. If you go on there, they have a whole thing. And this is what their nurses and doctors use for Tranq wounds. Now I'm going to give you a trigger warning. These are not pretty pictures. This is educational, okay? But these are not, repeat, not, capital N-O-T, not pretty, okay? Just, you're going to see things that look like steaks that were left outside in the sun. So as you can see, this is the beginning. Are there multiple small wounds? Not in a circular pattern. So no, Trish, stop lying. Intact scabs, superficial wounds, partial scabs. What you do is you leave them, okay? Partial scabs, you apply A&D ointment and leave them. Don't bandage them. Small wounds with drainage. You use the Xyloform and foam dressing and you change it daily. Small wounds with slough, if the skin is starting to slough off. They say the Meta honey, which is, what's it called? The honey from New Zealand. Oh, crap. I put it on Milo. Manuka honey. I'm sorry. They use the radiated, sterilized Manuka honey, okay? And foam dressing changed daily. Now, the only thing is that if they are out in the environment, on the streets, you cannot use Meta honey because you will get bugs. Literally, the ants will find you. And that's not a joke, okay? Now, once again, I'm going to say trigger warning. Trigger warning, look away if you don't like wounds. Is there concern for infection? Consult wound care. Discuss with your provider. If general surgery should be consulted to further evaluate. So at this point, yeah, right? It gives you have to order from the pharmacy. You use abdominal pads, Curlix to hang it on. Okay. Changing daily in PRN and changing every 12 hours in PRN. Okay, now it's going to get worse, guys. We have 2 more to go. Okay, look away. All right, now it's necrotizing, right? Is there non-viable tissue in the wound bed? Is it sloughing or eschar present? Eschar, E-S-C-H-A-R, is dead tissue. When your tissue gets dry and leathery and purple or black because the tissue has died, but it's still stuck there. It's hanging on, okay? So it tells them what to do using the Manuka honey, applying it to the wound bed, and Xyloform dressings, which are non-adhesive dressings with padding. Island dressings, abdominal pads or Curlix, the Metaplex change daily and PRN. And now we're going to get to the worst, which actually doesn't look as bad. It just looks like you have a steak on the table. Is there a clean wound bed? And as you can see, this is much cleaner. Cut the dressing to the wound size. Put on an island dressing if it's small, an abdominal pad and Curlex if it's moderate to large drainage, and a Metaplex if it's hard to dress area. Change daily and PRN. So the highlighted portion is kind of important because Trish wanted to say they were black spots that formed in a circular pattern. Let's see what Penn State says. Initially, skin blisters, most commonly around sites of injection. These blisters can then coalesce into deeper ulcers. Ulcerations may be deep and reach full thickness with exposed tendon and bone. Mind you, repeated use of xylazine over time causes wounds. We went over the theories of why. Poor perfusion and necrosis because of the vasoconstrictive properties of xylazine. Xylazine-associated wounds may become superinfected, which is characterized by peri-wound cellulitis, so infection, redness, and swelling around the ulcer, which we've seen, and purulent drainage, so pus. Infected wounds should be treated with oral or IV antibiotics depending on severity and presence of systemic infection. So depending on how bad the ulcers are and if there is sepsis, a systemic infection, sepsis, if the infection, say, has hit the heart and caused endocarditis, which is why all IV addicts get an echo. If it's hit the lungs, hit the kidneys, bugs will find anywhere they want to go. You can't choose, okay? And no bug from an IV infection has a specific location. It goes where it wants. And you are introducing it into your bloodstream. Trish can play the semantic game all she wants. She's not injecting xylazine. She's using fent, which we've heard a million times. But all fentanyl is mixed with a varying amount of xylazine. Whether a fent user wants it or not, they're getting it, period. So Penn State goes on, and this I found is everywhere. So it looks like rehabs and outreach centers and other schools are using pretty much Penn State's wound care guidance chart. And what it does is it shows you the steps of dressing changes. This is all how to change the dressing to debride, meaning cleaning and getting rid of all the necrotic tissue. Applying other topicals in varying things. Adding a primary dressing. So you're going to have the first layer dressing. And then you need to do a secondary dressing for leak through. If you have soaking of your initial bandage or pad, you need something else to soak it, because remember, most of these people are not in reach of hygiene, of showers. They're not washing their hands. They're out in the elements. And then when they get blacked out by the Tranq, whether they want it or not, they're blacking out and nodding off, and they fall on the ground, and their wounds could hit the sidewalk, which people walk on, spit on, shit on, piss on, whatever. So you need a secondary dressing as well as the padded aspect. You need padding because they're bumping into shit. They're getting in fights. You need something to pad that wound so it doesn't rip open. And then to secure it. In this chart, it does say meta honey, which is the manuka honey. Consider outdoor exposure and potential insect attraction. And then they give them how often, all the notes. And I found that, like I said, this chart is pretty much used by everybody. Now, if you Google Tranq sore images, all you get is a bunch of blurry pictures because they have to show the worst of the worst, right? But remember what they said. It starts as a little blister and swelling and then turns into the ulcerations, right? With the black center. And Trish wants to say this is from a sewage water canal in Cambodia. Showed a picture of the wound in Cambodia or Vietnam, whichever. And we'll look at that again. But Penn State said it started as a blister that then comes down into an ulceration. So it's like a volcano in a way. It starts off blowing up, filling with clear fluid, and then it like implodes on itself and it collapses into an ulceration, like a little crater. And then it goes from there, because once the skin is broken and it starts leaking, bacteria are introduced into the wound. And look what we see. A blister. A new blister. And what's that? That's the healed one. Now, another lie was the reason for the hands. And I noticed that this wound right here was very large yesterday and the day before. And now it's going down. The hands are very swollen and still very red. Don't mind the candida around the mouth and the nose and the bridge. But that was because Trish didn't have a washing machine, right? And was doing laundry by hand and the acids and all that. I can dispel that one too. But let's stay with the Tranq sores. This is the proof that was shown. Okay? That isn't a Tranq sore. Actually, it looks like either a belly button ring or... because that's metal. This is metal. That's metal. It could have been an impaling. It almost looks like... but it's a limb. Okay, it's an arm. So maybe it was sutured before with metal staples and they got pulled out. That doesn't look like anything that Trish has currently. And there are no satellite wounds as there are now. So let's see it in motion. So that was a staple. One thing I want you to pay attention to is when he finishes this. First off, look at the wipe on the edge of the sink. That's what he's cleaning his wounds with. And secondly, we have one eye open. We know what that means. He was cleaning it with a dirty makeup wipe. We're mumbling. Okay, we're going to see another wound. Couple of the ears still fighting. Looking at the blister. Satellite wounds. Big old hands that are red. We're wobbling. Oh, we're getting cash. The bathroom door's off now. You watch yourself constantly. This lady's asking brown recluse or black widow. Oh, brother.
I'm like, good. I'm a bad influence on myself. Stop it, Brandon. Yeah, that'd be fun. Oh my god, it would be. Yeah. Okay.
Those aren't bug bites. Those are Tranq sores. We also discussed how you can inject in one spot and they show up in another. Also, you can snort it, you can drink it, eat it, you can do it, you can smoke it, and those sores will keep coming out anywhere they want. Look at how red that is. Look at that. This is dangerous. Now, Tranq sores can heal on their own as long as you get doxycycline in you. Trisha's other side is looking better. She's been packing it and supposedly keeping it clean and washing it. That arm is still swollen, but it looks like the sore itself is going down, but she still has that raised line right there. See it coming off the end of the face down to that pink dot. That raised line is bad. Raised lines in an infection are bad. And look at the other side. Still swollen. That's the side that got IND'd, cleaned out by the VA. And look at it. This person wants you to believe they are clean, not using. When the filter falls off, you see the fungal infections, and along here that Trish claims is from not wearing makeup, and the candida is just growing. And what happens is addicts are prone to fungal infections because their immune system is compromised. And so it leaves them open to all kinds of infections and funguses. What happened to your face?
Radiation.
Wrong.
Radiation.
Wrong. Wrong. Trish is just in so much denial. And at one point last night, when people were getting on her about needing to go to rehab, there were so many excuses coming out of her mouth. It was hard to keep up, okay? At this point, and Hubs agreed with me when I said it, everyone was pounding on Trish. You need to go to rehab. You need to go to detox. You need to... And Trish fought it, tooth and nail. Look, back off. Back off. Some people are not savable. I said it about Lisa, and Trish is the same. Back off. They are enjoying this life. You don't like it. You want to save them. Some living creatures in this world cannot be saved. They're hell-bent. For whatever reason. Everyone needs to back off. Trish will take care of Trish. Don't add to it. Don't fund a habit. But don't keep saying you need to go to rehab. You need to go. You keep doing that, they won't go. I thought this was just a fun part because Trish without the filter is fun. There's still a filter on the phone, but this is YouTube, so there's no added filters.
Well, the first time I saw that, I was like, what did you just do? Clean the car. No. You threw shit out the window. Pull over. What? You heard me. Pull the fuck over. You can't throw shit out the window. Dude, yeah, I can. No, pull over the car now. That was a bit persuasive. And you get out and you like look around and you see all sorts of shit thrown everywhere. And you're just like... And then you kind of remember over that, years go by, and you travel to a developing nation and go in the ocean, and you're like, I don't know when the landlord came, but she didn't stay. She didn't stay. I didn't for her. No, it did not. We'll try again.
This is not clean behavior.
It's not responding.
So, not taking my medication, back to getting an infection, which I had like 50 days ago. So, for the last 50 days, I just been doing, turning off spinning my wheel. Acting like I don't need to take my medication because I need it.
Why can't I fucking find?
Stop closing the door for what? What are you shutting this down for?
Real quick, let's have a look at that hand.
You goofing around. We got no food, we ain't ate nothing except for ice cream I lose. We got no food, we wasn't.
He's the person in the 1960s or 60s.
No washing machine, right? What's that sound behind her?
Yes, what? Yeah, I mean, right there. Open up, please. Open up, please. Are you? Open up, please. Okay. Here we go. Okay. Right there. See? See? That's me back in Vietnam.
Not the same. But I hear a washing machine. Need more proof? Still humming. Not a Tranq sore. Okay, I'm gonna wrap this up with no sound but Milo snorting, but watching the Fenty dance. Because this is being clean and sober. 43 days. Those are Fetty sores. Those are Tranq sores. Pardon me. Tranq sores. Getting it in the fentanyl. And the mods and everybody watching knows it. Unless they're absolutely brainless. Look at that sore. Yeah, it is classic. They're everywhere. Puffy hand syndrome. Google it. Google it. Google xylazine. Google Tranq sores. Be prepared. This is not the behavior of someone clean and sober. I don't want anyone to die. I took a pledge to help people. But you can't help someone if they're in denial. And sometimes you have to let go. How can you help somebody who actually reaches the point of wanting help if you're tied up with somebody who doesn't? How many times does Trish have to say, I don't need rehab. I don't need detox. I don't need sober living. Early this morning, last night, she said sober living was a joke. She's jealous that Dobby keeps getting treatment. You know why Dobby gets treatment? Because he admits he has a problem. Until you take that first step and admit, I have a problem, you're not going to get any help. Why should taxpayers pay you to be on vacation in a psych facility if you don't want to take care of all problems? You can't just pick and choose. And Trish likes to think, like Lisa, that she can demand what is treated and what is not. Trish AMA'd out of the hospital. All these patients do, unless you have your friend bring you your fix and put it in the IV line. And then you can OD in the hospital and blame the hospital, which has happened. She's not going to the ER. The guy that was arguing in the background, I heard him say he had a maggot in his wound on his hand. That was the argument. I might be able to find that, actually, that clip, because I played it back like 3 times when I heard it. And he kept saying, I need doxycycline. He's got a Tranq sore too. That's why they were arguing in the beginning, because he needed to get in the shower and the chick wouldn't get out. Actually, maggots are good. But fentanyl sores do not come out in a circular pattern. They start as a blister, very small, very innocuous, and then they implode and crater. They can come out anywhere on the body. Don't let Trisha fool you. She's just denial and lying.